I'm Dr. Thaddeus John Bell. Today I want to talk to you about factors that increase your risk for atherosclerosis, or hardening of the arteries, as we used to say it back during the old days. There are several risk factors that you can control that will decrease your chances of developing hardening of the arteries. Number one, if you have elevated cholesterol, control it with medications. A common medical problem is that people get told that they have elevated bad cholesterol, they get put on medications, and they refuse to take the medication. Secondly, and you hear me talk about this all the time, if you have high blood pressure, you want to make sure that your blood pressure is at go. We have about 70 million people with high blood pressure, but only about 31% of that 70 million have their blood pressure under control. And then, of course, if you smoke, you're going to have to stop smoking if you don't want to develop hardening of the arteries. And of course, if you have diabetes, you want to make sure that you keep your diabetes at go. Have your A1C checked on a regular basis. Make sure that it's 7 or below. And of course, if you're overweight, you want to keep your weight at go. This is a hard thing to do because it's difficult to change. I would recommend that you make small changes when it comes to weight control, cutting back on your diet. And then, of course, not getting enough exercise is a definite risk factor for hardening of the arteries. As you can see, I got my exercise today. Eating an unhealthy diet full of fat, cholesterol, sugar, or salt will make you develop hardening of the arteries. So sugar and salt are very, very important risk factors that you want to decrease. And of course, here's one that we can't help, but it's going to happen to all of us at some point in time, and that is getting older. If you get older, the chances of you developing hardening of the arteries is very significant. And then, of course, having a family history of heart disease is certainly a major risk factor for developing hardening of the arteries or atherosclerosis. I think I'm going to go out and do a job. I'm Dr. Thaddeus John Bell, closing the gap in healthcare.